Secretariat of the Asian Pacific CRVS decade, has been leading the work on developing the report we are discussing today. Unfortunately, Dr. Alisjahbana is able to attend this event in person today. She has prepared a pre-recorded video message for us. Colleagues, please play the video.
Distinguished delegates, colleagues, esteemed participants, I am delighted to welcome you to the launch of the report, Getting Everyone in the Picture, a snapshot of progress midway through the Asian and Pacific Civil Registration and Vital Statistics decade. The report shows that the Asia-Pacific region is on the right path to reach universal and responsive CRVS systems, although we still have plenty of work ahead of us. This includes reaching the 64 million children under the age of 5, as well as many more older children and adults who have never had their birth registered or possess documentation to prove who they are. Every one of these individuals will go through life effectively invisible, facing difficulties whenever they are asked for documentation to access education, health, and social protection, thus rendering them potentially vulnerable to exploitation. And without their own legal documentation, these vulnerabilities may be transmitted to future generations. In 2014, in recognition of the role civil registration and vital statistics play in facilitating development, governments and development partners came together to concentrate efforts on improving CRVS systems. We collectively articulated the shared vision that by 2024, all people in Asia and the Pacific benefit from universal and responsive CRVS systems that facilitate the realization of their rights and support good governance, health, and development. Today is another key milestone for the CRVS community in the region. The results presented in the report we are launching showcase all the hard work and efforts of countries and development partners to make our shared vision a reality. The recent surge in COVID-19 in our region once again highlighted the urgent need for universal civil registration of births and deaths, including the accurate recording of causes of death. Quality and fit-for-purpose data is essential at all times, but is even more crucial when disasters or emergencies strike and urgent decisions are required. Governments, health authorities, and development partners need timely and complete data on births, deaths, and cause of death to know the extent of the issue, including among the most vulnerable. These data can guide evidence-informed decisions on where resources should be deployed and assess which interventions have been most effective. This report represents a milestone for every civil registration officer, statistician, health worker, and medical coder in the region. These professionals have worked tirelessly with communities to give them the documentation they require to live their lives in full and to provide governments with the statistics needed to improve health, socio-economic development, and good governance. In November, we will all meet again for the second ministerial conference on CRVS in Asia and the Pacific. Considering the profound development implications of civil registration and vital statistics, it is no surprise that many development partners are keen to support countries in their endeavor to improve their CRVS systems. At ESCAP, we are very happy that 12 partners have agreed to co-organize the second ministerial conference, and many of them are also here today. I'm pleased that over the last year, we have been able to expand our technical assistance and will be supporting even more countries over the next 12 months. This is a testament to the strong collaboration between ESCAP and development partners and the increasing awareness of donors of the importance of improving civil registration and vital statistics as one of the foundational building blocks for good governance. I'm also aware that each of the ESCAP subregions face different challenges to improve their CRVS systems. Therefore, ESCAP has collaborated with other development partners to organize sub-regional conversations on CRVS for the rest of this week. We hope you will join them to learn more about sub-regional progress since the beginning of the Asian and Pacific CRVS decade. We are very proud that this report represents another significant step together in our journey towards universal and responsive civil registration and vital statistics systems in Asia and the Pacific. Thank you very much.
Thank you very much to the ES for those, to the Executive Secretary for those wise words. Apologies for the technical issues earlier, but I think they've now been resolved. I would like to now invite Ms. Kamni Naidu, Administrator General in the Ministry of Justice, Government of the Republic of Fiji, and Chair of the Regional Steering Group for CRVS in Asia and the Pacific, to deliver opening remarks. Ms. Kamni has been a strong advocate for CRVS in Fiji and is an outstanding and active chair of the Regional Steering Group, members of which have provided substantial inputs to the report we are launching today. Ms. Kamni, the floor is yours.
Thank you, Pedro. Good afternoon, fellow colleagues. On behalf of the Regional Steering Group for CRVS in Asia and the Pacific, it is my pleasure to welcome you to the launch of the Getting Everyone in the Picture report, a snapshot of progress midway through the Asia and Pacific Civil Registration and Vital Statistics decade. Since the launch of the Asia and the Pacific CRVS decade in 2015, countries have made impressive strides in improving the capacity of their national CRVS systems. Countries in the region are increasing registration coverage to ensure no one is left behind, and they're producing vital statistics from registration records to inform policy. To make informed policy decisions. As the chair of the Regional Steering Group for CRVS in Asia and the Pacific, it has been my privilege to see firsthand the many activities countries are undertaking to meet their national targets for the Asia and Pacific CRVS decade. Countries have improved their system in many ways, and throughout the first half of the decade, we've enjoyed a collaborative spirit where countries learn from each other and worked hard. This includes developing and implementing new information and communication technologies to expand registration coverage and completeness, as well as training key stakeholders to ensure compliance with international standards, and a lot of activities to improve processes, legislation, and extensive campaigns for improving registration rates. We have had challenges. Regional challenges aggravated by the recent pandemic nevertheless persist in the face of our collective improvements. For example, while many countries saw an increase in the number of children under 5 being registered, our region still had approximately 64 million children of this age who are unregistered, meaning too many children will face unequal access to health and education services. Also, many countries are yet to conduct inequality assessments, and this may lack the information on marginalized communities necessary to ensure universal coverage. And while many countries deserve to be commended for producing vital statistics report for the first time, there are still many countries who lack the capacity to generate such reports annually. In turn, this means public policy makers are making decisions without the most important and most recent information vital to sound public and good governance, and many people are rendered invisible. The snapshot report being launched today will be a good starting point for our community to address these challenges before the end of the CRVS decade. The information from the report will allow us to tailor future activities to address remaining challenges, direct funding into areas needing specific attention, and enable stakeholders to build off the momentum created during the first half of the decade. As the chair of the Regional Steering Group, it is also important to recognize the information being published, which will guide us in our role as custodians of the CRVS decade. Because we are responsible for providing strategic guidance and regional oversight for countries implementing the regional action framework, we must pay close attention to the key messages presented to us by the country data and respond accordingly to their feedback. So in conclusion, the regional launch of the snapshot report is an important step in building the comprehensive approach to the second half of the CRVS decade. We will then have an opportunity to present this comprehensive approach to the responsible CRVS stakeholders during the second ministerial conference on CRVS in Asia and the Pacific, which is to take place on 16 to 19 November 2021. The conference will give us an opportunity to elicit support from the ministers and senior level officials for the areas, keeping us from getting everyone in the picture. So with that, I thank everyone for joining and thank you for your hard work and commitment. Thank you, Petra.
Thank you very much, Ms. Kamni, for those insightful remarks. Our next speaker is Ms. Gemma van Houderen. Gemma is currently the Director of ESCAP Statistics Division. Unfortunately for us, this is only for a few more days, since she will shortly be returning to the Australian Bureau of Statistics. However, we have been lucky that she is currently still with us and able to represent the ESCAP Statistics Division in this event. Gemma will present on the findings from the report and provide an overview of the progress made by countries in improving their CRVS systems. Gemma, over to you, please.
Wonderful. Thank you very much, Petra. And yes, it's a real pleasure to be with you here today. Let me now just move across to share with you the findings of this very important report. So as Petra said, my name's Gemma van Houderen, and it's a real pleasure to be here today as the Director of the Statistics Division of the Asia Pacific Statistical Community and ESCAP. We're going to dive in a little bit now on some of the findings of a midterm assessment of progress on getting everybody into the picture. And today's launch is of regional results, and the report is available. You can access it through that QR code or on the website. And tomorrow and for the remainder of this week, we'll also be doing sub-regional launches across the region, as we heard from our Executive Secretary from ESCAP, as well as the Chair of the Regional Steering Group, Ms. Naidu from Fiji. Civil registration is very closely connected to your legal identity, and it's a real life cycle throughout all parts of our lives. Birth registration provides a very efficient and permanent record of our existence, and then later in life, this birth certificate enables us to exercise our rights and access services such as education and social protection services. At the end of our lives, a death certificate represents a final and permanent record of the fact that death, and it's needed to manage legal and financial consequences of our death. Registration of birth, death, marriages, and causes of death can then be used for vital statistics, and these statistics can be critical for public policy, for governments, and for the 2030 Agenda for Sustainable Development. In 2014, governments and civil society partners came together here in Asia and the Pacific at a ministerial conference on civil registration and vital statistics. And they articulated this shared vision that by 2024, all people in Asia and the Pacific would benefit from universal and responsive CRVS systems that facilitate the realisation of their rights and that support good governance, health and development. To support this vision, a regional action framework was endorsed by all governments in the region with 3 goals, 7 action areas and 8 implementation steps. At the beginning of the decade in 2014, countries set national targets to monitor progress. And in this midterm report that we're launching today, we've assessed 7 of 15 targets set by national governments. Midway through the decade, we can see that 3 targets have been actioned. These are targets 2A and 2B on the delivery of birth and death certificates, and target 1E on the recording of cause of death for events for deaths undertaken in hospitals. We also see three targets are being actioned. Here, targets 1A and 1B on birth registration and on the registration of children under 5, as well as target 1D on death registration. For these, there is, though, considerable variation across our region, and I'll be explaining this in a moment. There's 4 targets where further action is needed. First, we need further action on target 3D on quality of cause of death coding. So across all parts of Asia and the Pacific, there is still a high percentage of ill-defined causes of death, and this just does not support good information. And when combined with the fact that many deaths are still taking place outside of health facilities, information on deaths and the causes of death in Asia Pacific is limited. The second area in need of action relates to vital statistics. The publication of vital statistics on births, on deaths, and on cause of deaths still needs action in our region, and there's been little progress made in this area since the start of the decade. I'll now go into a little bit of more detail. Firstly, let's have a look at birth registration. Birth registration is particularly important since birth registration enables us to access our basic human rights like education, healthcare, and social protection. And birth registration, very pleasingly, has been the focus of most countries' efforts since the start of the decade, in particular to leave no one behind. And your efforts are really paying dividends, and this is what our midterm assessment is showing. This graph shows the evolution of birth registration since the start of the decade. The black diamond is the midterm results. Where are we now? The blue bars show positive evolution since the start of the decade, and the red shows negative. Grey is where we have remaining progress to be undertaken. Now, this graph is showing that in East and Northeast and North and Central Asia, many countries already had high completeness of birth registration at the start of the decade. Many in South and Southwest and Southeast Asia, as well as the Pacific, were far lower at the start of the decade, but we're seeing very good progress in these countries. And this good progress is it's always shaped by country efforts. And with 2 in particular that we've highlighted in this report is the reforming of laws in Afghanistan, as well as the opening of civil registration desks in hospitals in Kiribati, have really been a catalyst for change and improvements in birth registration completeness in those countries. However, and as our chair of the Regional Steering Committee has just highlighted in her opening remarks, unregistered children of under age 5, even though it has been the focus of many countries and progress has been made, we are still seeing 64 million children under the age of 5, or that's 1 in 5 children under the age of 5, are still unregistered in Asia and the Pacific. Most of these, 50.2 million of them, were in South and Southwest Asia. But as you can see here on this graph, the highest percentage per capita is actually in the Pacific, where 1 million children under 5 are still unregistered. Now, an example of actions that can be taken to reduce this, I'm really pleased to highlight actions undertaken in Vanuatu following the cyclone Pam in 2015, where the Civil Registration and Vital Statistics Department organised registration campaigns, and more than 250,000 of the 270,000 adults and children in Vanuatu were issued a birth certificate following Cyclone Pam to ensure that everyone in Vanuatu was in the picture. Now let's turn to death registration, where again we saw great progress, but still more to be done. So here we have death registration. Though there's less incentives to register deaths, it is still very important for families and for governments that deaths are registered. for instance, for burial permits, for inheritance, and for measuring excess mortality. Now, death registration is lower than birth registration in most countries, but we are seeing increases and some significant scale-up of death registrations here in Samoa, in Cambodia, Lao PDR, as well as in Bangladesh. One area where we do need to take more action in the second half of the decade is the production of vital statistics from civil registration records. It is one of the 4 targets in need of action. It's also important for the 2030 Agenda for Sustainable Development, where 67 of the 232 SDG indicators benefit from civil registration of vital statistics data. 32 countries in our region with high birth and death registration completeness are already using civil registration records for vital statistics. And it's really very happy, ESCAP and all of our partners are very happy to be providing a lot of support for countries in this area of vital statistics production. Georgia, Niue and Bhutan have recently produced their first vital statistics report. But we still see 17 countries, mostly in South and Southwest, Southeast Asia and the Pacific, where they are still to use civil registration records for the production of vital statistics reports. Now, at the start of the decade, countries not only agreed to goals and actions, they also agreed to 8 implementation steps to shape the way that universal registration. Many of them have started and undertaken these steps. For instance, in Indonesia, we have a national CRVS strategy, and in Pakistan, a technical support unit was created. One step remains an outlier, and this is inequality assessments. And our vision, our regional vision for universal registration really does mean 100%. No one is left behind. And assessing inequalities, even in countries with high registration completeness, it's critical to ensure that no one is left behind. So all in all, this midterm assessment is showing that recognises the importance of civil registration and vital statistics, and our decade has increased. Civil registration systems are now more comprehensive and more robust. However, challenges do remain to achieve universal registration by the end of the decade. And the COVID-19 pandemic has also proven to be an additional challenge for us all. But it's also highlighting the critical importance of civil registration of vital statistics, and in particular areas like death registration and well-defined cause of death coding. So it's with these lessons in mind, the countries and partners will be coming together in November for the 2nd Ministerial Conference on Civil Registration and Vital Statistics in Asia and the Pacific, to review progress made, but more importantly, to map the challenges and to also articulate and map actions that we can take on the road to universal registration, to ensure that we leave no one behind, and to ensure that we get everybody into the picture. Thank you very much. Back to you, Petra.
Thank you. Thank you very much, Gemma, for that overview. Our next speaker is Mohammed Shahidul Islam, who is the Deputy Secretary, Cabinet Division, Bangladesh. He's also the National CRVS focal point for Bangladesh. As part of the implementation of the Regional Action Framework for CRVS in Asia and the Pacific, 53 countries in the region have assigned national CRVS focal points, who are in regular contact with ESCAP and other partners. These focal points were also responsible for working on the questionnaires for the midterm report. We asked Mr. Islam to speak today about the impressive improvements in CRVS that Bangladesh has achieved since the inception of the Asian and Pacific CRVS decade. As an example, Bangladesh has managed to double the birth registration rate for children under 5 since 2010, which is outstanding progress. Thank you very much for joining us today, Mr. Islam. The floor is now yours.
$350, 700.
Oo. Pero hindi sila 700 kasi
We cannot hear you, Mohammed. Mohammed, you are muted.
Mohammed, you're on mute. You need to unmute yourself. We haven't been able to hear you. Are you having any technical difficulties? Mohammed, are you able to unmute yourself? You're showing that you're muted still.
Oh, I see. Sorry. So I'll start.
If you can start from the beginning, we haven't been able to hear you.
Okay, I'm sorry. Welcome to you all in my presentation. Thank you, Chair, for giving me the opportunity to present the country progress on CRVS in such an important event. Before going to details on my presentation, I would like to share a few information on CRVS evolution to comprehend the situation. Formal civil registration in Bangladesh is very new. In 2010, Honorable Prime Minister given instruction to develop a national population register. After that, in 2013, a CRVS comprehensive assessment conducted by the collaboration with ESCAP and WHO. In September 2014, National Coordination Mechanism formed. According to the rules of business, Cabinet Division got the responsibilities to coordinate the CRVS activities in Bangladesh. After amendment of the Birth and Death Registration Act, the Office of the Registrar General of Birth and Death Registration was established and came into operational in 2016. Finally, in 2020, Office of the Registrar General introduced online birth and death registration system, means BDRIS, in all over the country. The progress on CRVS activities of regional action framework. Within this time, Bangladesh achieved all implementation steps except inequality assessment. Government has decided to conduct the inequality assessment. And second one, in case of monitoring and reporting, Office of the Registrar General has a plan to implement it through the BDRIS systems. In the meantime, in 2019, CRVS Steering Committee defined the CRVS++ policy and CRVS system architecture to establish an integrated CRVS system. Besides that, Bangladesh has a strong national coordination mechanism to establish a holistic CRVS system. There is a CRVS Steering Committee headed by Cabinet Secretary, the highest administrative authority under the Prime Minister. The committee consists of 25 members, including 19 secretaries of ministries for policy support. In 2019, birth registered estimated 22% and death registered in 33%. In 2020, birth registration rate is slightly decreased and death registration rate is little bit increased. Birth registration of children under 5 is achieving its year-wise targets. To ensure the citizens' right and to claim the identity, all individuals are provided with birth certificate immediately after the registration completed, as well as the death registration. In case of cause of death, first time Bangladesh introduced medical certification of cause of death and verbal autopsy in 2017 to determine the cause of death in facilities and community respectively. MCCOD scaled up in 122 hospitals and verbal autopsy scaled up in 13 sub-districts up to 2020. Health Service Division will scale up the MCCOD in the half of the total government and private hospital in the district and sub-district level by 2022. and plan for verbal autopsy scale up to a nationally representative sample 56 sub-district by 2024. In case of marriage and divorce registration, Law and Justice Division has taken an initiative to introduce online marriage and divorce registration system that will be integrated with birth and death registration data to identify the legal age of birth and death, bride and groom. The following actions has been taken by the Bangladesh government to strengthen the CRVS system. To make it comfortable in discussion, action area are divided into 5 thematic segments. First one is political commitment. Bangladesh has a strong political commitment, including from the Minister of the Local Government Division, accelerating the CRVS initiatives. Local leaders are actively engaged in birth and death registration as they are working as a registrar. Bangladesh has a prioritized strengthening its CRVS system to ensure everyone is counted, and including in planning and policy decisions. In case of policy, legislation, and implementation of regulation, Bangladesh has the Birth and Death Registration Act in 2004, which was amended in 2013, as well as Birth and Death Registration Rules 2017, which was also amended in 2018. These two legislation mandates civil registration. As a result, civil registration birth and deaths within 45 days of the event became law. Bangladesh conducted a legal review on CRVS related laws to remove the legal difficulties among them and to facilitate the service delivery to the citizen. At the same time, Bangladesh developed the birth and death as is business process map and evolving it into an as desired process map. You know, there are total more than 5,000 register offices are conducting online birth and death registration. Among them, 4,571 union council working as a registrar. This union council is the smallest local government unit in Bangladesh. Linking CRVS with other national systems, Bangladesh also working on it. Office of the Registrar General introduced unique ID at birth, which will help to establish interoperability with other CRVS implementing agency. Birth and death registration system is linked with National Identification Database and Health Service System DHIS2. BDRIS will link with Family Planning EMIS, Primary Education System, and Secondary and Higher Secondary System very soon. In case of public engagement and participation and generation demand, government is going to take necessary steps to increase the demand for birth and death registration. For example, to get the social security services like school stipend, cash benefit program for lactating mother, and other conditional cash transfers. Office of the Registrar General has taken necessary steps to raising community awareness campaign to address the demand side challenges and the benefits of registration. Union Council Chairman introduced congratulatory letter for birth and condolence message for death to increase the birth and death registration rate. In 2016, Bangladesh government engaged health sector to improve the civil registration birth and death. The government engaged health and family planning field staff in a formal notification process of birth and death registration in Kaliganj sub-district as a pilot basis, which is called Kaliganj model. In the meantime, Kaliganj model scaled up in 83 sub-districts where we get better results. Now, Kaliganj model is widely considered as a successful intervention for scale of birth and death registration in Bangladesh. Finally, in monitoring and supervision cases, Office of the Registrar General is going to find a way to implement the monitoring and evaluation framework to track progress on real-time birth and death registration. Also, established coordination mechanism at sub-national level to facilitate the harmonization between community-level health staff and local civil registers. Regular monitoring and supportive supervision at sub-district level resulted in more accountability and commitment of the service provider. A milestone initiative has been taken by the government to increase the birth and death registration completeness rate. That is, introduce birth and death registration targets in districts and sub-district level officers' annual performance agreement all over the country. Finally, I would like to conclude my presentation by saying that all of government leadership and contribution of concerned sectors can establish a whole of CRVS system in Bangladesh, which can fulfill the idea, get everyone in the picture. Thank you all for my patience hearing.
Thank you very much, Mr. Islam, for those insights from Bangladesh. And finally, our last speaker is Mr. Gogita Todrajde, Executive Director, National Statistics Office of Georgia, and Chair of the Committee on Statistics for Asia and the Pacific. Georgia has made great progress with the use of civil registration records for vital statistics over the first half of the decade. Indeed, we often turn to Georgia to provide support and advice to other countries developing similar systems, since there is much to learn from their experience. Mr. Gogita, over to you. Are you able to share, Mr. Gogita?
Hello, hello. 1 minute, just music.
Let us know if you'd prefer we share from our side.
Can you see my presentation?
Not yet.
Now?
Yes. Now it's come.
Yeah. So everything is going well, yeah?
So far, so good?
Yeah, thank you very much. First of all, it is my pleasure to address you on behalf of the National Statistics Office of Georgia. I would like to express my gratitude to the ESCAP and to all organizers of this virtual meeting for discuss such important issues and for giving the opportunity to share our experiences in the area of CRVS statistics. So let me start with the institutional arrangement of civil registration and vital statistics in Georgia. As you see on the current slide, there are three main institutions responsible for CRVS in my country. The Public Service Development Agency under the Ministry of Justice is responsible for the registration of civil acts, including vital events. The main responsibility of NCDC in the system is the quality check of cases of causes of death. At the same time, NCDC is the owner of medical certificate database. And in terms of Geostat, we are an official producer of demographic statistics in Georgia, which highlight our responsibilities for collecting, processing, and disseminating vital statistics in Georgia. Registration of civil acts as well as the production of vital statistics in Georgia is regulated by the law, such as Law of Georgia on Civil Status Acts, also Law on Official Statistics of Georgia, and there are also several decrees and joint orders of the Ministry of Justice and Health. Beside that, Geostat has annual statistical work program, which also includes certain part of statistical activities performed by different administrative bodies producing official statistics. Current slide shows the registration system of births and deaths in Georgia since 2017. In fact, when birth or death occurred in the medical institution, they actually complete medical certificates and automatically send them to the PSDA within 5 working days. It is worth to mention that since 2011, the medical certificates are filling electronically. And if birth or death occurred outside of the medical institution, the representative of the local administrative local administration makes an appropriate statement on theirs or bears based on the information actually provided by the family members, and they are sending these notifications automatically to the agency within 5 working days. Also, it should be mentioned that this CRV system is a significant achievement as it raised efficiency and coverage of vital statistics in Georgia. Production of vital statistics in Georgia is absolutely based on administrative data sources. Geostat receives the electronic data from PSDA and NCDC regular basis, and after processing, data are disseminated using our official web platforms. It is worth to mention that very good collaboration and strong partnership with owners of administrative data sources is in place. Data integration is another achievement for improving the data quality and coverage. As mentioned in the previous slide, Geostat receives births and deaths databases from 2 different administrative sources, such as PSDA and NCDC, and we are managing this mainly by using the medical number. A few words about quality issues. Since 1998, causes of deaths are coded according to the ICD-10 and the IRIS software recommended by the WHO for determining causes of death is used in Geostat since 2012. And additional quality checks for causes of death are performed using the Anaconda software, also recommended by the WHO. And however, despite of this, there are still some challenges and difficulties. NCDC works actively to improve the quality of causes of death data. The availability of personal information made it possible to carry out various activities effectively. This is performed with the help of regional public health center, and I would like to mention that at the same time the databases are compared with different alternative sources like cancer register and etc. I would like also to mention that improving the quality of causes of death statistics is considered by the strategy of National Statistical System for 2020-2023, and NCDC is the responsible entity for this activity. In terms of performed activities in the field of vital statistics, first of all, close cooperation with owners of administrative data sources should be mentioned. And before dissemination of the vital statistics report, we are sending it to them for their comments and recommendations, and we are grateful for their collaboration. The first vital statistics report was published in 2017. It was prepared with the support of Bloomberg Philanthropies Data for Health Initiative and the Statistics Division of the ESCAP, and within the framework of SDGs, in particular to strengthen the national capacity in producing and disseminating vital statistics. So production of VSR is considered now by the annual statistical work program once in a year. In Georgia, in English languages. And this is my last slide. It should be noted that all 3 goals of the ministerial declaration to get everyone in the picture in Asia and the Pacific, adopted in 2014, are mainly achieved in our country. However, we are working hard to improve the quality of data, which is never-ending process and part of our future work. Thank you very much for your attention.
Thank you very much to both Mr. Islam and Mr. Gugita for sharing your insights from a country perspective. It's indeed inspiring to see such progress in the region, even though we recognize that challenges still remain to be addressed. Our speakers have shown the criticality of inspirational leadership, strong governance, and clear coordination. To highlight these essential aspects of CRVS system strengthening efforts, our partners' vital strategies and other members of the CRVS Partnership for Asia and the Pacific have recently launched the Counting Everyone campaign. The campaign is calling on leaders around the world to champion strong CRVS systems to broaden the equitable coverage of civil registration globally. We believe that this report being launched today is a crucial tool in this worthy endeavour. So now we will turn to the question and answer session. If you have any questions to the speakers or on the report, please do type your question in the chat box. When you do so, kindly ensure you provide your name and organisation and state if you are directing your question at a specific speaker. To begin, we do have some questions that have been submitted ahead of time by participants in the meeting. And we'd like to begin with one question which was submitted by a colleague of ours at UNHCR. And this will be to Gemma, who presented on the report. And the question is, based on the findings of the report, what are the key gaps or priorities we need to help address during the last half of the CRVS decade in order to achieve the goals? Gemma, could you take that question, please?
Yes, certainly. Thank you very much, Petra, and thank you very much for that really very good question. The midterm assessment from the 46 countries who have responded to this midterm questionnaire have highlighted three main areas where we still have some work to do. The first one is around universal registration, and we've heard that from both Ms. Gugita from Georgia as well as from Bangladesh. So our vision in the region is universal registration, and this means 100% registration. And so even though we have seen huge improvements in birth and death registration, we still have not achieved 100% or universal registration. So we really would like by the end of decade to have pat ourselves all on the back to say we have achieved universal birth and death registration. The second area, and this is really highlighted in the results, which show that we still have a way to go in using civil registration records for vital statistics. And so we really, in this second half of the decade, look forward to working with countries in the region to make use of vital registration records for the purposes of vital statistics. And as we've just said, Georgia, NUI have just released their first ever report. So this is doable, and we're very happy that these countries have achieved this. And then the third area is our target around Leave No One Behind. And one of the implementation steps is to undertake inequality assessments. And so we are doing a lot of work, commencing quite a number of projects with countries to support them undertaking inequality assessments to ensure that even though we have really good complete registration, are we making sure we're not leaving anybody behind in those areas? So in summary, Petra, the 3 areas I would highlight is universal registration, making sure that we use our registration records for vital statistics, and finally, ensuring we don't leave anyone behind, and avail ourselves of undertaking inequality assessments. Thank you.
Thank you, Gemma. Our next question is also one which was submitted ahead of time, and this one I think we'll ask for if Bangladesh can address this. And this is asking, what is the role of the health sector in the strengthening of CRVS systems? So, Mr. Islam, could you take that question, please?
Yeah, thank you for asking this question. Actually, I told my presentation that in 2016, government engaged community-level health worker to reporting the birth registration in the community level. They are actually notify the birth and death registration to the local registrar. We are engaging this health worker and family welfare worker at a very small unit of our local government. They are working. Their area is very small. That's why they know each and every mother who are actually going to giving birth of their babies. So they, when they are actually going to, we are actually engaged in this scenario. Extended program immunization means EPI also. When day before the first dose of vaccination give the child, the health assistant conduct an interpersonal communication, means IPC, with the parents of the potential vaccinated child to prepare the child and bring him or her to immunization center. At the time of IPC, the health assistants bring a copy of the birth registration application and helps in filling up the application form. The parents are requested to bring the application form along with a copy of other documents, means national ID or other relevant papers to the center on that day of vaccination. Before the vaccination, the completed application will be verified along with the relevant documents and kept by the health assistant. He will put forward these application to the health inspector. Then health inspector will verify this application and submit it to the concerned union council, means union register who actually registered the birth and death registration within 45 days. By this way, we are increasing our birth and death registration in pilot area. Along with this process, actually we engaged another 2 activities. This one is a community sensitization meeting, operational orientational courses for field worker, and along with that coordination at sub-district level. By this way, we get the better result in our pilot area. Thank you.
Thank you very much for that answer. The next question I'm going to put together from two questions submitted, one on YouTube and one on MS Teams, and I'll invite either Ms. Kamni or Mr. Gugita to answer this. And that's around the registration of non-citizens. Can you perhaps speak about how you include non-citizens in your CRVS systems?
Actually, who are migrant in our country, they can register in our birth and death registration system. But for the refugee people in our law, till now we don't have any registration system, but they are registered by other ministry or departments which are not actually birth and death registration. Home Affairs ministries actually registering all those people. This is our national issue, so I cannot say anything more from these issues.
Thank you.
For
Please
Fiji's
go ahead,
case, we
Ms.
have
Kamni.
we only have people births births that happen in Fiji are the ones that are registered in the civil registration system. But if someone is acquiring citizenship in Fiji, then there is the immigration department which does the registration. But for our purposes, civil registration is for those born in Fiji. Thank you.
And Mr. Gugita, is there anything that you would like to add?
Yeah, thank you very much for your question. The main reason for this is issue and quality of administrative sources, especially what I want to say. These certificates is filled by the non-medical persons, and this is main reason. I would like to highlight also that the share of unknown causes of death equaled around 13% in 2019, a 7.2 point decrease from 2009. As a result of this above-mentioned implemented actions, it has shown decreasing trend, but this is still remains high.
Okay, thank you, Mr. Gagita. I know there's more questions which have come in, but unfortunately we are actually coming to the end of our hour. I would invite the panelists to, if you wish to answer the questions in the chat, to please do so, and we will try to summarize these answers. In the meantime, I would like to thank you all for your questions and such an interesting session. If you'd like more information, I strongly encourage you to read the report, Getting Everyone in the Picture, a snapshot of progress midway through the Asian and Pacific Civil Registration and Vital Statistics Decade. In there, you will find plenty more information about CRVS in Asia and the Pacific, and more examples of activities and reforms conducted by countries. The report is available in English and in Russian at the link shown on the screen. We understand, however, that not everyone has the time to read the full report. Therefore, we've also prepared a microsite for the report with summaries of every chapter. You may also access country stories there, as well as download the data provided in the report. As I'm sure you're aware, the Asia and Pacific region spans a wide area and more than half of the world's population. To allow for more in-depth analysis, as mentioned by others earlier, we will also conduct sub-regional discussions on progress. Those for the Pacific and South and Southwest Asia will take place tomorrow. On Thursday, we will have events for Southeast Asia and North and Central Asia. I encourage you to attend these events to learn more about progress made in these sub-regions and continue these discussions. The launches are organized in collaboration with some of our many dedicated partners working on CRVS in Asia and the Pacific. We are extremely fortunate to be working with our friends and colleagues towards our common vision, and the support each organization provides is part of the story of progress we have been able to share today. Together, we are certainly greater than the sum of our parts. I'd like to thank you all for attending this event today. I hope you enjoyed today's discussions. More events on CRVS will take place leading up until the second ministerial conference on CRVS in Asia and the Pacific to take place in a hybrid modality, meaning both virtually and physically, in Bangkok on 15th to 19th November 2021. The ministerial conference is again an effort of many organizations and will be co-organized by ESCAP and 12 development partners. We are very grateful for all the hard work contributed by our different partners on the conference and beyond. Invitations to the ministerial conference will be sent to countries in the region over the next couple of weeks. I invite you to visit the website of the CRVS Decade to get more information on the conference, and I look forward to seeing you at future events. So all that remains is for me to thank all of our presenters for their fantastic contributions, and to thank you all for attending and demonstrating your interest in this very important cause. And with that, I would like to close this meeting. Thank you.
Thank you, Petra.
Thank you so much, Petra.
Thank you so much.
everyone.
Thank you, Alden. Thank you all.
Thank you.